Finding a painful, swollen bump in your most sensitive area can be incredibly distressing and even frightening. You might be wondering, is it an infection? Is it serious? Or did I just do something wrong? Today, we are discussing vaginal boils. These uncomfortable lumps are more common than you think, and in most cases, they are easily treatable. By the end of this video, you will understand exactly why they form, how to tell them apart from other conditions, and most importantly, how to find relief. Let's start with the basics. Medically known as a furuncle, a vaginal boil is essentially a deep-seated skin infection that starts in a hair follicle or an oil gland. While we call them vaginal boils, they actually occur on the outer genital area, specifically the labia majora or the pubic region. It usually starts as a small, firm red bump that is tender to the touch. Over a few days, it fills with pus, grows larger, and becomes increasingly painful. This happens because your body is sending white blood cells to fight off an invader, creating a localized inflammatory response. Understanding that this is a localized skin issue and not necessarily an internal reproductive problem is the first step towards peace of mind. So, what actually triggers this swelling? The most common culprit is a bacterium called Staphylococcus aureus, or simply Staph. Interestingly, Staph often lives harmlessly on our skin or in our noses without causing any trouble. However, if there is a tiny break in the skin, perhaps from a microscopic scratch or a nick, the bacteria can enter the hair follicle. Once inside this warm, moist environment, the bacteria begin to multiply rapidly. Your immune system recognizes these invaders and sends white blood cells to the site, which results in the formation of pus. This battle between your immune system and the bacteria is what creates the pressure and pain associated with a boil. The journey of a boil often starts as folliculitis, a superficial inflammation of the hair follicle. If the inflammation isn't resolved, it can progress deeper into the tissue to become a full-blown boil. In the genital area, we have many oil glands and sweat glands. If these become clogged with dead skin cells, sweat, or oils, they provide the perfect breeding ground for bacteria to thrive. This is why boils are particularly common in areas where hair grows. Any disruption to the natural drainage of these glands or follicles can set the stage for an infection to take root deep beneath the skin's surface. Lifestyle habits play a major role in the development of vaginal boils. One of the leading causes is shaving or waxing. These hair removal methods can create tiny, invisible micro tears in the skin, giving bacteria an easy entry point. Furthermore, as new hair grows back, it can become ingrown, irritating the follicle and leading to infection. Another significant factor is friction. Tight clothing, synthetic fabrics that don't breathe, or repetitive movement during exercise can cause skin-on-skin or skin-on-fabric rubbing. This friction irritates the skin and forces bacteria deeper into the pores, especially in the warm, moist environment of the groin area. While external factors are common, internal health also matters. If you find yourself getting frequent or multiple boils, it might be a sign of an underlying systemic issue. For instance, individuals with diabetes are more prone to skin infections because high blood sugar levels can weaken the immune system and provide a food source for bacteria. Similarly, any condition that compromises your immune system makes it harder for your body to fight off staph. Hormonal fluctuations, such as those during your menstrual cycle, can also increase oil production in the genital area, making blockages and subsequent infections more likely during certain times of the month. It is very important to distinguish a boil from other types of lumps. A common look-alike is a Bartholin's cyst. These occur specifically in the Bartholin's glands, which are located on either side of the vaginal opening and provide lubrication. If these glands become blocked, a cyst forms. Unlike a boil, which is a skin infection that can appear anywhere on the labia, a Bartholin's cyst is always located right at the entrance of the vagina. While a cyst can become infected and turn into an abscess, which is very painful, a simple cyst is often painless. If you have a lump that is deep and right at the opening, it is likely gland-related rather than a simple hair follicle boil. Another source of anxiety is whether the bump is a sexually transmitted infection. Genital herpes, for example, usually presents as a cluster of small, fluid-filled blisters that are very painful and itchy. They eventually break and crust over. Genital warts are typically flesh-colored, painless, and have a cauliflower-like texture. In contrast, a boil is usually a single, large, red, and firm lump that eventually develops a white or yellow head of pus. If you notice multiple sores, or if the bumps are accompanied by flu-like symptoms, it is essential to see a healthcare provider for testing to rule out an STI and get the correct treatment. While many boils resolve on their own, some require medical attention. You should see a doctor if the boil is extremely painful or growing very quickly, you develop a fever or chills, the redness starts spreading to the surrounding skin, which could indicate a spreading infection called cellulitis, or if the boil doesn't drain after a week of home care. Also, if you have a condition like diabetes or are pregnant, you should be extra cautious. A doctor can perform a procedure called incision and drainage to safely clear the infection, and in some cases, they may prescribe oral antibiotics to ensure the bacteria is completely eradicated from your system. If your boil is small and you have no warning signs, home care is the first line of defense. The best thing you can do is apply a warm compress for 10 to 15 minutes, several times a day. The heat increases blood flow to the area, helping your white blood cells fight the infection and encouraging the boil to drain naturally. Keep the area clean and dry, and wear loose cotton underwear. Most importantly, never squeeze or pop a boil yourself. This can force the bacteria deeper into the tissue or into your bloodstream, leading to a much more serious infection. Let the boil come to a head and drain on its own schedule. Preventing future boils is all about hygiene and reducing irritation. Switch to loose-fitting, breathable cotton fabrics. If you shave, use a clean, sharp razor every time and shave in the direction of hair growth. Consider alternatives like trimming or laser hair removal if you are prone to boils. Use a gentle, fragrance-free soap for the genital area to avoid irritation. Remember, your body is resilient, and knowing these facts puts you in control of your health. Understanding the causes and proper care for boils allows you to manage them effectively and know exactly when it's time to call the professionals. If you found this guide helpful, please give this video a like and subscribe to MedSimple TV for more clear, reliable medical explanations. Stay healthy, and we'll see you in the next video.